Well, Trisha and Todd, this is the first time that Clark County has reported more than 1,000 cases in a day, and health officials here at the Southern Nevada Health District say that that spike in cases is really a function of two things. Now, first, there's been a marked increase in the number of tests completed every day. With additional equipment, officials say the district itself has been able to do about 2,000 tests a day, and down the street, UMC had been doing about 4,000 a day. Well, now they're capable of doing 10,000. Officials say people's reasons for getting tested have also shifted from those simply displaying symptoms to people who need to get tested for employment or travel, or just because of being concerned by the rising number of cases. Officials say the second factor had to do with delayed reporting from one of the commercial labs. When backlogs like that happen, you can see a spike in reported cases. Beyond that, Dr. Mike Johnson says Clark County continues to see a rise in the number of cases in young people, in particular those 18 to 24. As for the mortality rate, COVID-19 can still be deadly for some, but Dr. Johnson says the high-risk populations are likely practicing social distancing and staying at home as much as possible to keep themselves safe.
I think that's when you say, well, we see these big increases in cases, but not in mortality. I think part of it is because the most vulnerable populations right now for mortality may be doing the right things.
Now, Dr. Johnson emphasized that we are still in the middle of a pandemic. He says this is not the time to throw caution to the wind. It is the time to continue social distancing, washing your hands as much as possible, and wearing your face mask when you're in public, because of course anyone who has the virus can pass it to those higher risk populations. Reporting, Jackie Kostek, 13 Action News.